Hi, I'm Doreen Dempster, one of the OB-GYN physicians here at Door County Medical Center. This video is designed to provide you with basic information about gynecologic surgeries to make you better prepared as you go into the surgery. Obviously, you may have specific questions and concerns that you should address with your surgeon at your preoperative visit, but hopefully this will get most of those questions answered today.
Hi there, my name's Rachel and I'm a registered nurse in the Women's Center.
And I'm Terry, I'm a medical assistant in the Women's Center. This video is designed to provide you with information about your gynecological surgery.
Our goal is to provide you with everything that you need to feel well prepared for your surgery and to assist you in your recovery after surgery. We know that when patients are well prepared for surgery, they will, 1, have a more realistic expectation for what the surgical experience will be like, 2, they'll encounter less anxiety and stress throughout their hospital stay, and 3, they'll be able to make a better and faster recovery after surgery. The nurse will provide you with a guidebook with detailed information about how to prepare for and recover after your surgery. You'll find suggestions for things that you can prepare ahead of time or things that you can do once you're home that will make life easier for you. These are some things like preparing and freezing healthy meals, obtaining items that you may need to assist you in recovering after your surgery, such as getting over-the-counter pain relievers or constipation medications or ice, just some good things to have on hand. Be aware if you have any activity restrictions or driving restrictions after your surgery so you can arrange assistance in getting to all of your follow-up appointments. Any adjustments you may need to make at home to better accommodate your recovery based on activity limitations.
If you are a smoker, stop smoking. This will reduce the risk for pneumonia and enhance your recovery after surgery. If you require FMLA or short-term disability paperwork filled out, get those papers to us as soon as possible in order to prevent any delay in obtaining needed time off or compensation for your coverage. Our financial counselors will prior authorize your surgery. But if you have specific questions about what your financial responsibility will be concerning copays or coverage, you should contact your insurance company directly.
Stop or limit your alcohol consumption. Also, if you use illegal substances, be sure to tell your provider, as these can interfere with anesthesia and can be dangerous. Ask if you will have any lifting or activity restrictions so that you can plan accordingly after your surgery. See the pre-op guidebook about things to prepare for at home, especially if you have pets, and how any of the activity restrictions may interfere with your pet care after surgery. Mind and body work in union to help recover, so be sure to take a look at the section in your guidebook that addresses how anxiety and depression may influence your recovery. We want to set you up for the best possible outcome after surgery.
Complete final preparations at home, including picking up any items you may need from the store, such as over-the-counter pain medication, constipation medications, ice, and other supplies. There's a list in your guidebook. Do not shave anywhere near your surgical area. If hair needs to be removed, we will use a special set of clippers that limits the risk of infection. Remember to bring your CPAP machine to the hospital on the day of your surgery. If you are going to be staying overnight, bring an overnight bag. Remember your phone and charger as well. The surgery department nurse will call you 1 to 2 business days prior to your surgery to review important information and give you arrival times. Arrival times are based on the surgery schedule for that day and are not determined any further in advance. Because you will be having anesthesia, a friend or family member will need to drive you home after your procedure. They will be able to wait in our surgical department during your procedure. Follow these guidelines for when to stop eating and drinking prior to your procedure. Clear liquids should be stopped 2 hours prior to your procedure. Clear liquids include water, black coffee, juice that is not red or has pulp in it, or soda. A light meal should be stopped 6 hours prior to your procedure. Fried foods, fatty foods, or meat Additional time is required for fasting, and that should be stopped 8 hours or more prior to your procedure. Remember, no jewelry, no piercings, do not apply any makeup. Leave all valuables at home. Bring your CPAP if you have one. Take your usual morning medications unless directed otherwise by your physician.
So you'll arrive at the main entrance of the hospital, which is entrance number 1, and you'll register at the desk in the lobby of the hospital. You'll wait in the lobby until a nurse brings you to the 3rd floor, which is our surgical floor. Your preoperative nurse will review your medical record, your preferred pharmacy, and have you complete a second set of CHG wipes that they'll give you once you come. You'll change into a gown with your underwear removed, and an IV will be started and a blood pressure cuff applied to your arm. Any hair that needs to be clipped will be clipped. Do not shave the surgical site prior to your procedure. You'll meet with your anesthesiologist, who will go over spinal anesthesia versus general anesthesia, and a urinary catheter will be inserted if needed. You'll meet with your surgeon, and then after the procedure is completed, the surgeon will speak to your family or your friend that was designated by you, and you'll remain in the recovery unit until your vital signs are stable and you're able to be removed to the outpatient surgery room, or you're transferred to the hospital for further recovery. Dependent upon the type of procedure, you may go home that same day or you'll stay for the next day.
As with any surgical procedure, there are risks involved. In general, the likelihood of a major complication following GYN surgery is low, less than 5%. However, it's important that you know the risks involved in surgery before you have any surgery so that you are informed and can make good choices about your health care. Risks of major GYN surgery include bleeding, needing a blood transfusion or a large incision on your abdomen to fix any bleeding, surgical injury to intra-abdominal content such as bowel, bladder, blood vessels, or the ureters, which are the tubes that run the urine from the kidney to the bladder. Rarely, after GYN surgery, you may need to go home with a urinary catheter for a few weeks, or even more unlikely, a colostomy bag or diversion of your bowels if an injury occurs. More common things that can happen would be a small separation in the incisions on your abdomen, delayed return to sexual functioning. Some women have pain after intercourse following GYN surgery, or rarely may need additional surgeries if precancerous or cancerous conditions are found at the time of surgery. While these risks may seem daunting, it's important to understand all risks before undertaking any surgery. Talk with your surgeon with any questions that you have. Be sure to write them down so you have all the answers that you need to make the best choice for both you and your body. We want to get you back up to 100% as quickly as possible following your GYN surgery here at Door County Medical Center.
Be sure to take a look at your guidebook for suggestions for making your recovery as smooth as possible. You should expect to have some post-surgical pain, and you'll be instructed for how to treat that post-surgical pain. See your guide for suggestions for how to deal with your pain after surgery. Depending upon the type of surgery you've had, you may experience some crampy abdominal pain or referred pain to your shoulder. So referred pain is due to carbon dioxide that is used to extend your abdomen during surgery, and the carbon dioxide may travel to your shoulder and create a pain or pressure there. This can be normal. Dependent on the type of surgery you're having, you may require sanitary or menstrual pads for post-operative bleeding and loose-fitting underwear that does not cut or bind. Avoid lifting greater than 10 pounds for approximately 6 weeks after your surgery. You may bike 2 weeks after surgery if approved by your surgeon. Do not use tampons, sex toys, or have sexual intercourse or put anything into your vagina until cleared by your surgeon. If you had a hysterectomy, this will be for about 8 weeks, and 1 to 2 weeks if you had a DNC. No horseback riding for 12 weeks after surgery unless approved by your surgeon. And it's normal to feel fatigued. Just make sure that you're getting as much rest as you need. For bathing and incision care, Be sure to wash your hands before and after you change your dressing or touch the incision site. Keep the incision clean and dry, and do not use any ointments, creams, or lotions near the incision for 3 to 4 weeks after your surgery. Unless you're told differently, you may shower when you feel up to it after your surgery, but do not soak in a bathtub. Do not scrub your incision site. Just let the soap and water flow over the incision and pat dry with a clean towel. If you have steri strips covering your incision, leave them alone and they'll fall off on their own, or after 2 weeks if they are still applied. You'll be given instructions, discharge instructions before you leave the hospital that include the signs and symptoms to watch for and when to call us or seek additional care. There are also instructions in your guidebook regarding this as well. Medication refills require 72 hours notice, so please call ahead of time if you need refills, and you can call us at 920-746-3666. Make sure to keep your post-operative appointments with your surgeon. Thank you so much for your time and attention during this video. You'll now meet with a member of our Women's Center nursing team to complete the rest of your instructions and have an opportunity to ask any questions that you may have.
You can also view this video again on our website.